Hello, everyone. Good afternoon and welcome to Do Your Parents Want to Stay? My name is Stella Song. We do this session every week as a way of educating the community and bringing information from experts and giving you insights so that you could make very good decisions for your loved one. Every day, every week, we get these questions of what am I going to do with my mom now? She doesn't want this. She does not want that. The doctor says this. The neighbor says that. And I don't know what to do. The bottom line is she wants to stay in her home. That's the reason we named this segment, Do Your Parents Want to Stay? So we do this every week. This is where you come if you have a question regarding anything associated with elder care. Every question that some family may have is connected to where the loved one is going to stay. Where are they going to age in place? Where are they going to live? Are they going to be home? Are they going to be in assisted living? Are they going to be in a daughter-in-law or son-in-law suite? Where are they going to be? So we have these sessions and we invite experts to come and talk with us. So every month we have an area of concentration. This month we're concentrating on after hospital and after rehabilitation care. That is a big one. This is a big topic. Last time when we were here, we talked about what happens in rehabilitation. And today we are going to talk about how you stay safe in your rehab, how you find equipment, how do you know what to get, who do you call when you need XYZ, how do you help your mom find the right adaptations for home? How do you make the home safer, especially after a hospital and rehab stay? So today I invited an expert. She is the go-to person. She is a mobility expert. She will help educate us today. And I want to introduce Mushmi. Mushmi, hi, nice to see you. Welcome.
Thank you, Stella. Thank you, Jennifer. It's wonderful to be here, and I'm so glad that I would be answering some of the questions that they have when they are very overwhelmed while they go back from a hospital, and there are no ways that they could think of where I come in and at least help them, educate them of how they can be more specific, more comfortable when they are home with their children, and even the families know what they are doing for them, but they can look out for what their parents need at this point of time. Thank you.
You're welcome. So the biggest question that Jennifer and I will get relating to equipment, and people are actually, we are right now at 2025, and even though things have changed in the last years, many people do not know that you cannot get equipment the way you used to get equipment. I got an email from a gentleman and he says, my mom has insurance, Medicare to be precise. How do I get a walker shipped to our house? And I thought to myself, my goodness gracious, this poor guy, right? But that was not it. And then he continued and he told me this long story of all the things he need and how they want to make the house safer, and so that because the mom doesn't want to be with them, and like all of that. So our biggest thing we want to hear from you, Mushmi, today is what are like your top 3 tips associated with going home and having the right safe equipment?
Sure. So after hospital or after rehab care typically refers to post-acute care and continuation of the care services that help patients transition safely from a hospital or rehabilitation facility back to their home. So our priority as Mobility Plus or as an expert who can consult on how to move around is your recovery. That's our priority, okay? 3 things that we need to take care. First thing is the challenge. The challenge is many patients and families feel overwhelmed when transitioning home after the rehab stay or rehab, and questions like, how do we make the home safe? What equipments do we need? These concerns are real, and ignoring them can lead to falls, injuries, and even readmissions, which we do not want. No. So that's the first challenge that we face. So when we come to the solution, Mobility Plus really give out solutions rather than just going out there and telling them, you need this, you need this, you need this. Transition smooth and stress-free, providing them wheelchairs, scooters, and walkers for mobility, lift chair and hospital beds for comfort, and bathroom safety solutions to prevent falls. We need to understand just one thing, that these mobility equipments help you prevent any kind of further injuries to you.
Mm-hmm.
We need to make sure what the patient has gone through in the hospital, what are the doctor reports telling about them, which is the particular injury that we are focusing on. Is it a shoulder? Is it the spine? Is it the leg? Is it the hip? Is it the ankle? What? Accordingly, an equipment is designed. The equipment is already designed for their comfort.
Right.
We need to make sure what the patient needs at this period of time, and how they can make the utmost use of that equipment, what they are spending for. We need to understand one thing, they are going to spend quite a time with that equipment. Rather than families and everything, that equipment is going to stay with them for a longer period of time unless they come back to their feet.
Okay.
The age.
Right.
Another thing matters is their independence. After the hospital, after they got care from the doctors, the nurse, they would want to have their families, they would want to have them not to be a burden to their families for a longer period of time.
Right.
So their independence with dignity matters for them. They wouldn't want their children to always be careful, always be looking out for them, always be overwhelmed for them.
Right.
So independence here matters. Recovery at home should feel safe, dignified, and empowering for them. So that's why we work closely with families, caregivers, and even hospitals to ensure every patient gets what they need for the successful recovery. So that's number one tip here.
Okay.
So if you or someone you love is coming home from hospital or a rehab, let us be your partner in care. Along with the nurses, we can work so many good things for families and the person who's been given care out of, because your recovery is everybody's priority right now. Whoever is working for you wouldn't want to always care for you for your life.
Right.
We would prioritize your recovery so that once you are on your feet, once you are there, we as a partner, we as a working partner for the nurses and everybody who is in line in your journey from the hospital to your home can feel much safer. And you feel dignified that, yes, I did that myself. I use this. This is my companion. These are my families. Everything which comes to your recovery is what your and our priority is.
That is good. That is good. Because the challenge sometimes that families go through is figuring out where to get the equipment.
Yes.
See, long time ago, you walk into a store, you say, "Hi, I have Medicare, and can I have this and that?" And where's your doctor's order, and off you go. Yeah. All of that has now changed, right? So, Musme, what is the process for getting? What's the process for getting a shower chair, or a hip kit, or a walker, or a wheelchair? What do families do now? What's the new thing?
So once they are in, of course, the procedure that you have gone through, what kind of surgeries you may have. If you had a fall, what is the affected part of your body? That's what we ask them the first question as. What are you facing? What difficulty are you facing right now? What part of your body is the most affected that we need to take care of? If it is your ankle, yes. Ankle and knees takes the maximum part of the weight of your body. So going through a hospital has everything that they need. They take, their patient lift and they move you out from here and there. They have the wheelchair. So what it is, you cannot turn your room into a hospital again. There is no person who is taking care
No.
of you just as the nurses in the hospital.
Right.
What are the specific things that you actually need? Going for a bathroom shower chair, that's actually important for anybody who loses balance at the age of 60, 65. They start losing balance because the tissues and the muscles, they are not as strong as it used to be. So a bathroom chair is a chair where you need to at most take care that how the surface of the bathroom is, how is your balance of the body, what is the weight of your body, what is the bathroom chair where you do you need to transition from your bathtub towards the floor, how is the geography of your bathroom, do you have a tub, do you have a walk-in shower, what we need to educate them. A piece of chair lying in your dining table is different what lies in your bathroom. What needs to be your priority once you enter the bathroom? How do you want the chair to provide you? So, for example, if the person has a fall and he's not able to move his leg, and he has a shower tub in his bathroom, he's not going to break it in 2 days and make a walk-in shower and everything.
Right.
We have a chair which transitions him from a flat surface into his bathtub without even moving his leg,
Nice.
without lifting his leg.
Okay.
So that is how a procedure for a bathroom chair goes.
Okay. So, but and Medicare doesn't pay for these. When I was a home health nurse, this is how we would say it to patients. If it's in the bathroom, Medicare doesn't cover it.
That's it.
So Medicare does not cover shower chairs. Transition chairs does not.
No.
They'll do a 3-in-1 bedside commode, correct? Yes?
Yes, bedside commodes you do have. Sometimes if you are in an acute position, Medicare sometimes may provide you them.
Okay.
May. I'm just saying may.
All right.
Not sure. And that too, how much time that they take to, finish that procedure and bring that bathroom chair into your bathroom. The time also matters.
Is it true that Medicare would take Medicare months and months to deliver equipment?
Yes, of course. And
There's a family I know, they had ordered, I think they ordered a hospital bed, and they did not get the hospital bed for 5 months. 5 months.
That's
5 months.
True. That's true.
Very, very sad. Okay.
Yes.
Mushmi, how can people find you and your business? Give us your phone number so that if we have people who are listening to us and they want to learn which equipment they need, how to use it is really important because safety is first. How do they find you?
Okay, so Mobility Plus is located in Norristown, Pennsylvania. Our zip code is 19403. We have been in business for quite some time this year, and we are searchable on Google. I will share all the details with you. We have our Facebook, we have LinkedIn, all social media. We have presence on all social media platforms. Recovery, yes, being our priority, our first concern would be how we can provide the best solution to your caregivers or your family.
Yay.
So reach out to us here just for getting the first-hand information and solution to your condition.
Very good. Thank you. Thank you.
I have a
Hello,
question.
Nurse Galina. Do you have a question for Mushmi?
Yes, I do. Hi, Musmi. How are you? So that's great because, we deal with elderly. So any new piece of equipment come out that can help with the movement is always good. But let me ask you, so you're in Pennsylvania. Do you do other states? Do you deliver to other states?
We actually deliver to all the northeastern states because Mobility Plus has just one presence in the northeastern states. So we do not have any territorial boundaries. We have many hospital beds going out in the state of upstate New York, upstate Pennsylvania, New Jersey, even Maryland. Last week we just shipped out one of the hospital beds in Maryland. So even Delaware counties, yes.
Okay, awesome. So then we can give your number to the family and you will guide the family from, how do you do your assessment? Does the patient have to be at home? Or
A
like in
patient,
preparation
yes.
for discharge? How do you?
It is most important to have a patient at the place where he's going to spend that time of recovery. So yes, we go do an assessment, may it be for home modifications also, like where do we need the grab bars, where do we need a standing pole where maybe he or she are cooking. They need a standing pole to grab onto. They need a perfectly good threshold ramps where they can move with their wheelchairs through the rooms, through the kitchen, through the bathrooms. So a home modification assessment, mobility equipment assessment is important that we do before we kind of give them a solution to that.
So you physically go into the homes?
Physically, or we can also do a video session with them if they are comfortable.
Okay, that's good. And you don't charge nothing for that assessment, correct?
Assessment is nothing, yeah. If it is really too far, maybe the technician or the evaluation, whoever is coming, usually they just charge a $50 or something. But if it is nearby, 50 miles or something, it's totally free.
Okay, that's good to know.
Like only home and community-based people will call 50 miles close because they go everywhere, right? And that is a great service. That is a very great service. So we're going to be doing a program, the One Fall Can Change Everything program, between Mobility Plus and PennDYNAMIC. So we are collaborating and we are looking for the specialists who can bring this great information. So we have this 3-part series called One Fall Can Change Everything. And one part is about hospitalization, rehabilitation, and home care. The other part of the 3-part series is financial matters and family matters, right? How do you pay for care? How do you manage care for your mom or your dad when you have to work? And then the other part of it is living well after recovery, or living or aging well, right? So we talk about geriatric wellness and assisted living and independent living and staying as well as possible. So we are working on that collaboration, and we're excited for what's coming. So we'll be rolling that one out. Yes.
Of course. So excited to work with the caregivers because they are the first responders to those people.
Yes.
And they really do a great job of explaining them, maintaining their calm while they are treating them. Yes.
Yeah, it's a good thing. It's a good thing. All right. Jennifer, thank you for hosting us again. So give our audience the phone number that they can call us at PennDYNAMIC for anything elder care, small amounts of care, long care, living care, care management, post-hospital, post-rehabilitation, disease-specific care, anything caregiving. We are here for you at PennDYNAMIC Care at Home. And by the way, Jennifer, the one thing I did not tell our audience, somebody had asked, how are you guys different from all the other home care companies? And my first comment was, number one, we belong to a class of our own. We have no competition. The reason that we love to say that is because we provide personalized care that you can't get anywhere, right? You cannot get personalized care anywhere unless it's brought to you wherever you call home. But the other thing is, we have no minimums, none whatsoever. So you can get care for as little or as much as you prefer. You get to pick your own hourly rate. Yes, we give you a list and you say, I like this rate versus this rate, and each rate comes with its own condition. You get a chance to meet our caregivers ahead of time. You can interview them. You can see all their credentials, all the full transparencies there for you. And we work very closely with the home health care and the doctor's offices. We bring clinical data that doctor's offices can actually look at and say, my patient's getting better. So that we don't get these unnecessary hospital readmissions. Home health cares love us because we can help them discharge quicker. We can help them discharge safer, and we can help to reduce unnecessary readmissions. Yes. So we are proud at PennDYNAMIC Care at Home. We are proud. This is our thing. So you want personalized care? We are here. We are on standby, waiting to hear from you. All right. So Jennifer, give everybody our phone number, and we will see you guys next week. And we hope you stay well and safe.
Yes.
Thank you. Thank you so much for hosting us.
Sure.
And Plus is always one step ahead in assisting any caregiver organizations. You can reach out to us on 215-907-7587, and we are located in Pennsylvania, Norristown. It was such a pleasure to be speaking over here. And
Yes.
PennDYNAMIC, the caregivers, you are doing an awesome job. Thank you. Thank you for reaching us out.
Sure.
Contact us at 610-467-7827, extension 3. And also, you can go over to our website, www.dynamiccareathome.com.
Good. All right. Take good care, everyone. Be safe, be well, and stay warm.
Stay warm. Perfect.
All
Happy
right.
holidays to everyone. Take care.
Thank you. Same to you.
Bye-bye.